Hello, my name is Christian Abilzo. I'm the interim co-director of the Health Research Center at West Virginia University in the WVU School of Public Health. And on behalf of my colleagues, Dr. Bias, Jesse Kaufman, and Emily Vasile, I welcome you to this webinar. I'm here to talk to you today about program evaluation, some of the basic elements of it, and how it might be applicable in the Growing Healthy Communities projects. So let's jump right into it. And on the screen you see the question, what is evaluation? And many of you probably have an idea of what you think evaluation is. You know, every day we evaluate things, whether it be the meal that we've made or the service at a restaurant or individuals that work for us in a supervisory capacity. And that is absolutely evaluation. Now, oftentimes that is more on the informal side of evaluation. So today we're going to talk to you a little bit more about formal evaluation. And in a more formal evaluation, you know, what we do is work with folks to identify and clarify and apply a set of solid criteria. Over time, we work to identify ways to measure and assess a program, a policy, a project's value against those criteria so that a decision can be made about the worth or merit of whatever is being evaluated. Now, in the Health Research Center, the HRC, we view evaluation as working with our clients and people in the community and stakeholders to figure out what matters in measuring a program to determine, you know, whether it's worth continuing that program or, you know, what could be changed to make the program even better. And that's another type of evaluation, a difference. It's a difference between formative evaluation, which is more early on in the process or the lifespan of a program, and to decide, you know what, maybe this doesn't work, this piece of this program doesn't work, and we'll substitute out something else. We identify what's not working and try to help you figure out a way to make things work better. So that's formative evaluation, more early in the process or the lifetime of a program. Now later in the lifespan of a program, do something more of a summative evaluation, which is probably what you're more used to, sort of at the end of a program, deciding, well, we either want to keep it or we want to get rid of it based on these numbers that we put together. Again, that's more of a summative evaluation. What we like to do is work with folks early on, regardless of whether it's a formative or summative evaluation, to help identify the criteria and help measure whatever outputs or processes come from the program to determine its value and make a decision about it. One good way to think of the difference between a formative and a summative evaluation is to think about food. We all love to think about that. The difference between formative and summative is the difference between a chef tasting the soup and a customer in a restaurant tasting the soup. The chef tastes it to see how they can make it better. The customer tastes it to decide, you know what, maybe I like this or not, and send it back or keep it. So that's a difference, a good way to think of the difference between a formative and a summative evaluation. So on this slide you see a statement that really summarizes the way we view our work in program evaluation here at the HRC. You know, the real goal of an evaluation is to improve a program. So as we work with clients and as we produce some findings through our evaluation, they're only useful if they are used to make a difference, to help improve whatever we are evaluating. So the next question comes up, you know, when should we conduct an evaluation? Well, thinking about how we view evaluation here at the HRC, you know, honestly it can be done at any stage, but we think the best time is when we're planning a new program or at the conception of a program. Oftentimes you probably see it at the end of a program. We'll also be doing that with some of the former grantees. And if you look at evaluation that's done early on in the life cycle of a program, when it's being planned, that can really be done to work with stakeholders and to get a lot of people involved to identify clear steps and outcomes and outputs of a program that all of the relevant stakeholders want to see. We'll talk more about stakeholders on the next slide, but it can be a very good way of figuring out, how should this program look? What should we be doing to reach the objectives that we would like to reach? Then, as you move along the lifespan of a program to a program that you've already planned it and you're starting to implement it, you're trying it out, taking a test run. In a developing program, what an evaluation can do is really get some fine-grained details about what seems to be working about a program and what doesn't. Again, that's like the chef tasting the soup before it goes out to the front of the house. You taste it, see if it needs to be refined before it goes big. That's what you can do with a developing program. You can take a look at a lot of the processes, how we thought we would be implementing this program or how we'd be doing it, and see if that was the reality. And if it was, what is realistic for doing something? Let's say you had proposed to build 20 miles of trail with $10,000. Well, once you really got into it, you looked at the nitty-gritty of it and the geography, the topography, you saw that materials costs themselves may be too much. So that was just maybe a failure to plan on the front end the right kind of inputs, the money that would be needed, or that there was a policy or a private land ownership in the way. So that's something that once you try something out, then you assess that that aspect of it, the piloting or the development of a program, to see how it could be refined and made better. Then, an evaluation can also be used to assess a program that's a little more stable and mature. So after that developmental stage of the lifespan, we move to a more mature program. So you've already tried it out once or twice, gotten some evidence, some evaluation information back about what's working and what's not, and you've improved things. So now you go a little bigger and you start to get more people or more land, whatever it may be, in this program or project. And then you assess it again, because then maybe new barriers or new things could come up that you could work on to make it an even better program. Again, this might be more like the whole kitchen staff tasting the soup instead of just the chef before it goes out to the customer. So again, evaluation has its place for a more stable or more mature program before it's fully launched. And it's a good point now to introduce the idea that evaluation doesn't happen just at the beginning or just at the end of a program. Let's say you have a program that's going to last a year, maybe in a school or something. What should be done along the way is monitoring, every couple of weeks or every month, some of these tasks that you hope to accomplish on a timeline to get you to the outcomes of the program. So again, here at the HRC, we work hand in hand with people on the ground, the people that are running a program and managing a program, to just see if the program is meeting timelines and tasks, which is very important. That feedback along the way is really important to really making sure a program runs as smoothly as possible. Now, the other way to look at it is at the very end of a program, an evaluation can assess sort of an up or down decision on a program at times. You can look at not only the processes and the things that came out of a program, but also how that affects people out in the real world. So if we think about, again, let's say a trail being built, obviously there are some inputs that you have to think about, like land acquisition and money and things like that. But what are the outputs of a program? I mean, it could be feet or miles of asphalt or concrete. It could be signage. It could be many things that we would call outputs that are directly developed by the program. But then beyond that, it's what's the impact, what are the outcomes you like to see in human beings. So you would expect to see more events, you would expect to see more people on the trail, whatever it may be, or economic development near or on the trail. So that's something you would often see in the assessment of a program after it has ended. After it is completed, you would often see some of those outcomes to decide to make that value judgment of whether the program is quote-unquote good or bad and maybe should continue or not. So the key to remember on this is that you can do or you can conduct an evaluation at any point in the life cycle of a program. Ideally, it happens early on, but it can also be done at the very end. So what you see on this slide is a framework provided by the Centers for Disease Control and Prevention about public health program evaluation. Now, the key to remember in this, you don't have to follow it from 12 o'clock all the way down to 6 and back up. You can jump in and out of this outer ring of steps, the blue text, at any point really. Although ideally, it does follow some of that logical order. In the first step, it's engaging stakeholders, and the stakeholders are really key because they can help you at every stage about describing the program, helping focus the design of the evaluation, and gathering evidence, and interpreting and justifying the conclusions, and making changes and understanding the lessons learned. So when we look at stakeholders, you look at them sort of in 4 categories. First is those that have authority or ownership over the program. And those are sort of high-level managers. Those could be funding agencies, people that can give the sort of thumbs up or thumbs down decision whether to continue a program or end it. Second category of stakeholders is those responsible for implementing a program. So that could be, those are the folks that are day-to-day operations on the ground that are overseeing a lot of the implementation steps and ensuring the timelines are met and things like that. Third category of stakeholders that needs to be engaged are those that are affected by the program. So when we look at a lot of the Growing Healthy Communities grants, they would obviously impact community members, whether it be through farmers markets, trails, whatever it may be. Lastly, there are those that are sort of disaffected, or those that may be hurt by the program. That seems odd, but maybe there are people out in the community that if you get this money, they might not. So those things we have to watch out for and identify those folks as well to understand sort of the political landscape of the evaluation as well. And when you move around sort of the 2:30, 3 o'clock there, we talk about describing the program on the circle. Oftentimes there's evidence or there's information about a program gathered by the evaluators, looking at documents, sort of grant applications, talking with sort of the key stakeholders that have ownership over the program, just to better understand. I learned something. I have a background in counseling as well as physical activity and public health. And early on in my days as working with folks on health behavior counseling and helping them change health behaviors, I learned that I, as at that time an early 30s male with no children, is not the expert of a mid-40s female that has 4 children, a full-time job, and many other responsibilities and volunteer work. I learned that lesson very early on, that I am not the expert of you. You are the expert of you, and that's exactly how we feel about communities. Here at the HRC, we understand that you are the experts of your community. You know the political landscape. You know all the key players in your community. So we would definitely be calling on you to understand who the key stakeholders are and how to describe the program in the context that you're in. And again, as we move around, stakeholders again will be engaged to help focus the evaluation design. Looking at all the documents, what do you propose to do? How can we assist you in maybe understanding if you've met your objectives, if you've produced what you had hoped to produce, and what the outcomes are. We would work with you to figure all of that out to help focus the evaluation design, because there's so many things that we can evaluate in these things, but we want to work with you to narrow that down to be feasible and practical and as accurate as possible. You see those standards in the middle of the circle. As we move around to 6 o'clock on that circle, basically, is gathering credible evidence. At the end of the day, we want to be accurate, and we want to work with you to understand what information is out there that we can collect, identify certain measures, be that receipts, sales receipts at a farmer's market, or the number of people attending a walking event on your new trail, whatever it may be. But how can we gather that credible evidence and work with you maybe to gather new evidence if we're thinking about a future activity. And at the end of the day, the last couple steps are justifying the conclusions and ensure that the conclusions and the evaluation we produce is used and shared amongst others. So in justifying the conclusions, again, we have our ideas why things may or may not have happened, but so would you as someone in the community, someone involved in the project. What we can provide is sort of the higher view from out beyond the community, from outside the community that is not necessarily involved in the day-to-day and maybe not colored by the day-to-day operations of your project. And at the end of the day, we want to make sure that the evaluation is used. So we have we would work with you to figure out how you would want information presented to you. I remember a key lesson I learned from a politician that says, I don't care how great your study is, your research, your evaluation, if you can't boil it down to a 3-word bumper sticker, I probably don't have time to use it. So that really stuck with me, and now we have turned to using single, one-page infographics, very simple visual representations of our evaluation work, as well as, to look credible, longer reports, but nothing massive. And one thing we hope to see in the Growing Healthy Communities evaluation project is to see, what is working well in some of these places and share those lessons with other communities where things may not have worked, where you have similar projects. So, hopefully we can help you share lessons across grantees and at the end of the day really make West Virginia a fantastic place to live, work, and play. Now on this slide, we'll talk a little bit about objectives and how to make them SMART. And a lot of you have probably seen this when we talk about goals or objectives, but oftentimes this is where grant writing, this is where things kind of fall off a little bit. So what we like to do is think of this as very specific objectives, throw a number on exactly what you're talking about, something measurable, something you can actually, in other words, something you can actually go count or quantify, something achievable. Don't be unrealistic with what you are hoping to do, and something relevant. That means it really fits with what you're trying to accomplish, and then something time-bound that has a deadline. A different way to think about this is when you're writing an objective, it will oftentimes have a verb, a metric, a population or object, a baseline measure, a goal measure, and a time frame. So if we look at a SMART objective, like one example is increase miles of paved walking trail from 1 to 5 miles in Glenville by August 2016. As we break that down, you see a verb, that's to increase, a metric, that's the miles, the population or object is paved walking trails, the baseline measure is 1 mile, the goal measure is 5 miles, time frame is August 2016. And that is something that then you can piece together and look at what do you need as far as inputs, as far as money, labor, sponsorships, etc. What timelines do you have to meet to achieve this objective? And then you have a very obvious way of measuring whether you've met the objective or not. Now the last piece of a really good evaluation is dissemination, basically just getting the word out about the results of your project and what the evaluation found. And this really ties back to stakeholders. So we need to look early on at who needs these results and maybe how they want them presented to them. So funders may want to see the real nitty-gritty executive summary and full write-up and evaluation report and how we went about collecting information, etc. That's great, that can be done. And those are those people I talked about that may have authority over the program. But then there are the community implementers, and those are, like I talked about earlier, the folks that are responsible for implementing the program. They may want to see results in a very different way. They may want to see that infographic that talks about, here's what we said we would do to get where we wanted to go, and here's where we got. Something very simple, like a one-page infographic that's visual, or a one-page executive summary that's just bulleted lists of information. And then obviously other communities, those are other stakeholders too, because hopefully there's some lessons learned from this that they might be able to use. So maybe what they would focus on is, okay, maybe this other community met or did not meet the objective of a trail project or whatever, and I have a similar project. What did they do that worked, and what did they do that didn't work? So some of the process evaluation, looking at some of the mechanics of the program might be more useful to them. But then as we talk about policymakers, they, again, like I said earlier, they may want to see that 3-word bumper sticker about the program or whatever you did. So we really, early on, we have to identify and engage with these stakeholders and ask them how they want information presented to them. And then you see the format of the dissemination, meaning how should the results be put out there. Again, should it be fully detailed? Maybe that's what the funders wanted to see. Or is it a very high level, just certain pieces of the evaluation? And do people want it written? They want it visual? They want a press release? They want a big splashy thing out in the news media? Or is it a gathering where we just pick things apart? Or is it a big presentation? I mean, again, the format should be identified early on, and that should be identified with us as evaluators and with you as stakeholders and owners of these programs. And that's really it. So summarizing, talked a little bit about what evaluation is, informal versus formal, as well as that formative versus summative evaluation, the chef versus the customer tasting the soup. Talked about when an evaluation can be done, and key to remember there, it can be done at any time, and it just has different purposes through what an evaluation could be during the lifespan of a program. Sort of how it's done as we look at that CDC framework, that big circle, engaging stakeholders and all the way around to disseminating. And then we really wanted to focus you in on how to write some very smart objectives, how to pick those apart, and then how maybe you would want to disseminate the results. So we really appreciate the time, and we look forward to working with everyone, and we really hope that all the programs that you hope to do work really well.